Welcome to the Friends Advocacy Training for Global Health Core Fellow and Alumni. I am Shrew Clickham, and I am the Associate Policy Director. Thank you so much for joining us, and I hope this is helpful. So first, we'll just go through the agenda. The first part goes over the budget introduction, the appropriations process, global health financing, the proposed cuts by the administration. The second part is focused on advocacy, on how to advocate and how to message. So let's begin. Part 1, the budget, appropriations, and upcoming cuts. The budget and appropriations process is expected to follow a rigid calendar and series of procedures, but those deadlines and procedures are rarely followed. A small number of key components are important to understanding the federal funding process. In the largest sense, the government funds a substantial and diverse range of programs and activities, from global health programs to Social Security to military operations. The majority of federal spending consists of mandatory spending, sometimes also called entitlements. Our nation's 3 largest entitlement programs are Social Security, Medicare, and Medicaid. These are all mandatory funded programs. The government allocates funds to all those who are eligible, regardless of the annual costs to Treasury. Mandatory spending is generally governed by a statutory criteria, and it is not normally set by the Appropriations Acts. The other category funding is known as discretionary spending. All federal funding that reaches international development and global health programs are part of this discretionary spending. The authority for discretionary spending stems from annual appropriations acts, which are under the control of the House and Senate Appropriations Committees. So how does the budget appropriations process work? First, the funding process is an annual event. Congress is tasked with producing a budget resolution and 12 appropriations bills for each fiscal year, which begins on October 1st and runs through September 30th. The president's budget request starts the process, and then Congress responds. The president's budget request details the administration's position on the full range of federal revenue and spending. But it's really important to remember that the president's budget proposal is simply a request. It has no binding authority on Congress and is best understood as a detailed statement by the administration of its fiscal goals and policy preferences. The first step in the funding process is the creation of a concurrent congressional budget resolution. The budget resolution sets the total level of discretionary funding, known as the 302A allocation, which you can see right here in the middle of the screen. The bottom yellow box is the 302A allocation for the following fiscal year. Budget resolutions are supposed to be filed by April 15th, although this has been very rare in recent years. With the 302A allocations determined, the funding process moves to the appropriations committees in each chamber, which you can also see on the graph. The appropriations is responsible for determining program by program funding levels. This is done through 12 separate appropriations bills, each generated by a specific subcommittee covering individual federal agencies or groupings of agencies. The chairs of the appropriations committees, under the direction of the appropriations committee chairperson, divide the 302A allocations among the 12 subcommittees. This allocation provides the total funding pool for each of the appropriations bills, known as the 302B allocation. Basically, the 302A allocation represents the size of the whole funding pie, while the 302B allocation is equivalent to the size of one of the 12 slices of that pie. For example, the bill that covers global health programs is the State Foreign Operations and Related Programs Appropriations Bill, and it covers USAID, the State Department, and a handful of multilateral funding streams like the Global Fund and Gavi. So this is what the federal budget process looks like in a normal year. The president releases his budget for the following year in February, with the budget committees following up with their draft of the budget resolution and appropriations committees beginning their hearings in March or April. The appropriations committees then begin to draft their spending bills for their particular jurisdictions, and then from May to July, the House will begin passing their appropriations bills. These bills are then sent over to the Senate for consideration. The Senate will then amend the House spending bills through the appropriate subcommittees. The House and the Senate will then negotiate the differences in the bills and sign a final appropriations bill package by September 30th. If they can't agree on a full funding bill for the following fiscal year, they will pass a continuing resolution, which usually funds the government for a predetermined amount of time. That is typically the same level of funding as the previous year's spending levels. However, this timeline that you're looking at right now hasn't occurred in many years. Although the president did get out his budget on February 12, 2018, we have been living on continuing resolutions for the past several years. So in terms of the federal budget, the international affairs portion of the budget makes up a small percentage of the entire budget at 1.4%, or roughly $60 billion. So in a Kaiser Family Foundation study published in early 2015, the average respondent thought that 26% of the entire federal budget went to foreign aid, more than Social Security or Medicare, in fact. Unsurprisingly, more than half respondents thought that the United States was spending too much on foreign aid when they thought it was 26% of the federal budget. But with the federal budget only at 1%, we're making the case that foreign aid has multiple benefits that could have positive impact spending in other categories. The total international affairs budget is again at roughly $60 billion, with global health making up only 0.25% of the entire federal budget, and the Global Fund making up 0.001% of that at $1.35 billion. So as you can see, global health spending for the U.S. government is very, very small. The U.S. is the wealthiest nation in the world, and only 0.25% of the entire federal budget goes to the global health programs. This is a very small amount in terms of our budget, but in the larger global health financing context, it makes a world of difference. Knowing the history and the facts about global health financing during advocacy is also very important. So here we have a chart that shows U.S. global health funding by sector in FY 2017. The FY 18 omnibus has similar levels, so this chart shows a pretty true depiction of current levels of spending in global health. So while very little of our budget goes to global health, it's important to understand what part of the budget goes to which particular global health programs. As you can see from this chart, HIV/AIDS is a very large piece of the pie at 49%. HIV and AIDS has historically been funded higher than other global health programs. This is largely due to the HIV/AIDS epidemic impacting millions of Americans in the mid-1980s and 1990s. AIDS activists changed the course of the epidemic, calling for more funding both in the US and globally. By 2003, the President's Emergency Plan for AIDS Relief, or PEPFAR, and the Global Fund to Fight AIDS, Tuberculosis, and Malaria, or the Global Fund, were started in tandem to tackle the HIV/AIDS epidemic globally. With PEPFAR started shortly after the Global Fund, the funding has largely been maintained for both programs and has historically had strong bipartisan support in Congress. In this fiscal environment, our advocacy efforts are to maintain this level funding, both in global health programs and in the entire international affairs budget. So this chart shows the U.S. global health funding from FY 2006 to FY 2018. As you can see, U.S. investment in global health has been relatively flat for nearly a decade. However, in the greater global health financing context, again, this is a lot of money. As part of an effort to encourage other donors and implementing countries to increase their own investments, Congress should expand the highly effective global health programs, including PEPFAR, the President's Malaria Initiative, and USAID's tuberculosis programs, along with the Global Fund, to really ramp up investments in global health. So this is a chart showing the U.S. funding for the Global Fund from FY 2001 to FY 2018. A little bit more about the Global Fund is that it's a 21st century private-public partnership designed to accelerate the end of AIDS, tuberculosis, and malaria as epidemics. It's a financing institution and it provides support to countries in the response to the three diseases. It does not implement programs on the ground. It raises and invests nearly $4 billion a year to support programs run by local experts in countries and communities most in need. Global Fund financing comes primarily from the public sector, with approximately 95% of total funding coming from donor governments and the remaining 5% coming from the private sector, private foundation, and innovative financing initiatives. The U.S. is a leader in the Global Fund, galvanizing financing from other donor countries by requiring a 2/3 match from other donors worldwide. For every $1 the U.S. invests in the Global Fund, other countries and private sector partners must invest $2 more. The Global Fund raises financing in multi-year cycles known as replenishments. The fifth replenishment solicited funding for the 3-year period from 2017 to 2019 and mobilized $12.9 billion for 3 years. The U.S. government committed up to $4.3 billion to the Global Fund through 2019. In order to fulfill the $4.3 billion commitment, the U.S. must continue funding the Global Fund at $1.35 billion in FY19. The president did propose to cut the Global Fund in 2018 to $1.125 billion, but Congress stepped up and appropriated the full $1.35 billion in the omnibus for 2018. The president again cut the Global Fund in his recent FY 2019 proposal to $925 million, which was a $425 million cut to the Global Fund. And as you can see from this chart, again, I've highlighted that in the omnibus, the Global Fund is funded at $1.35 billion. So why is the Global Fund important? Why should the U.S. continue to invest? The Global Fund has saved over 22 million lives since 2002, and there have been 1/3 fewer deaths from AIDS, tuberculosis, and malaria in countries where the Global Fund invests. In terms of financing for programs, the Global Fund currently finances 11 million people on antiretroviral therapy. 17.4 million people have been tested and treated for tuberculosis, and 795 million mosquito nets have been distributed. In terms of development assistance for health by source funding, in 2017, the total development assistance for health amounted to $37.4 billion. This chart that you see depicts the 27-year trend of development assistance for health by source funding. The main sources, as you can see, for development assistance for health in 2017 were the national treasuries of the United States, providing $12.4 billion, or 33% of the total in 2017. And you can see that I've highlighted the United States government's contribution and how it's the dark maroon color at the bottom. Second behind the U.S. is the United Kingdom, which provided $3.3 billion in 2017, or 8.8% of the total. Additionally, the Bill and Melinda Gates Foundation provided $3.3 billion, or 8.87% of the total in 2017. This chart really highlights the importance of U.S. investment in global health, both historically and looking towards the future. Again, while also highlighting that it's only 0.25% of the entire U.S. budget. You can see how important it is here in the global context. So this second figure shows the development assistance for health by channel of assistance. This figure shows the 27-year trend. And in the last decade, you can see that the Global Fund, which is light purple and I've highlighted on the screen, and Gavi have gone up increasingly since 2010. And these channels have provided critical assistance during a time when some sources have contracted. The very high growth rate from 2000 to 2010, especially for Gavi and the Global Fund, is associated with the Millennium Development Goals and the founding of these two partnership programs. However, the period of growth from 2010 to 2017 has largely been a plateau. So the importance of this chart shows that our advocacy focus needs to be focused on the U.S. being a leader in global health and why we must invest and why we must continue to invest. And we'll delve a little further into messaging after this section about global health financing. So the administration's FY 2019 proposal was released on February 12th, 2018. The administration proposed to again slash funding for development and diplomacy despite overwhelming bipartisan opposition in Congress to the administration's proposed deep and disproportionate cut in FY 18. Senator Lindsey Graham famously called that president's request dead on arrival, and more than 230 members of Congress, from the Freedom Caucus to the Progressive Caucus, spoke out against these dangerous cuts last year. The administration's proposal also proposes cuts that would take funding back to levels that we have not seen since prior to 9/11. And it would cut funding for the international affairs budget as a percentage of the GDP to its lowest level since World War II. The administration's proposal also very much cuts the international affairs budget at 30%, and global health programs were cut by $2.1 billion, or 23% below FY 17. The cut to HIV/AIDS programs was $1.2 billion, or 20% below FY 17. PEPFAR received an 11% cut, while the Global Fund was cut by 31%. Go a little bit further into the Global Fund. The U.S. contribution to the Global Fund again was cut by 31% compared to 17% in the proposed FY 18 request. Despite the proposed 17% cut last year, Congress rejected it and continued to maintain funding for the Global Fund at $1.35 billion in 2018. We hope again that they will reject the president's proposal for an even deeper cut. This chart depicts the cuts from the president's FY 2019 proposal compared to both 2017 enacted levels and the 2018 request. As you can see, the FY 19 request provides $6.7 billion for global health funding, $2.1 billion, or 23% below the FY 17 level. In addition to the 11% and 31% proposed cut to PEPFAR and the Global Fund, respectively, you can also see the various cuts to other vital global health programs. For example, malaria was cut by 11%, tuberculosis was cut by 26%, vulnerable children was completely cut by 100%, family planning is cut by 50%, and global health security is cut by 100%. So despite the deep proposed cuts by the administration in his previous proposal, funding for global health was largely protected in the omnibus. This highlights continued bipartisan strong support in Congress for these programs. The omnibus provides a total of $8.69 billion for global health programs, which is just $35 million below the FY 17 enacted level, and maintains FY 17 funding levels for bilateral HIV/AIDS programs, the Global Fund, malaria programs, and international family planning. Several programs even received increases, including maternal and child health and tuberculosis. The omnibus also sets out just $73 million for global health security, but includes authority to redirect $100 million in Ebola funds to strengthen countries' capacity to prevent and respond to outbreaks, and $35 million for USAID's Emergency Reserve Fund to respond to emerging threats. Notably, the bill rejects the administration's original proposal to eliminate funding for family planning. It also holds funding for PEPFAR and the Global Fund flat at $4.3 billion and $1.35 billion, respectively. And it provides $290 million for Gavi, the Vaccine Alliance, which is a $15 million increase. So as you can again see, Congress protected the global health funding in the FY18 omnibus, despite the president's proposal of deep cuts to global health. So Congress's power of the purse cannot be understated. The good news is that Congress, both Democrats and Republicans, have had a very strong reaction against the president's budget and his proposed cuts, and we hope that that will continue with FY19. So this concludes the presentation on the appropriations process in global health financing, and we are going to move on to part 2, which is advocacy and messaging for global health. So first off, what is advocacy? Advocacy is the act of building support for an idea or cause. It's the deliberate process of influencing stakeholders. It's using your voice as a mode of power to inspire and mobilize. Lobbying is a specific type of direct advocacy, but advocacy more broadly is about inspiring and mobilizing, which, as you all know, is one of the Global Health Corps' 6 core leadership practices. So how to advocate? How do we advocate? This slide really explains how to effectively message and advocate to various members of Congress. So the first key part of advocacy is the research piece. Research is largely about knowing your audience, what their background is, what issues they support, or what issues they don't support. I just want to underscore here how important it is to know who you're talking to. You won't be able to devise a powerful message to affect change otherwise. Those of you coming to DC will be sending you briefing packets on the members of Congress you'll be meeting with. We look at their voting record and other considerations. For example, if they have a military background, that would help shape your message. Second, be intentional about your message. The most important part of your message is to speak from a place of authenticity with regards to your story and what excites you or is meaningful to you. So it's important to cultivate your own story and share it purposefully in order to move others to action. The kind of story you share will be determined by the audience and ask, whether it's for funding programs or encouraging policies. For folks coming in person, you should begin thinking about your story and the other stories you could share. Third, you need to be clear on exactly what you want to say. Less is more. In addition to your story, what are your key messages and what is your ask? Be clear and concise. This is very, very important. Finally, practice and get feedback from others. It will help you hone in on and stick to those key messages. That's more powerful than rambling, and you'll have a large opportunity next week to do some of that practice. Finally, you have limited time and attention, so you want to deliver the most powerful and compelling communication you can. Advocacy methods. There are various different kinds of advocacy messages, including lobby days, letter campaigns, grass tops, thought leadership, communications, and cultivations. Next week, we will focus on the lobby day, but communications is also key. We will be sharing a social media toolkit on how best to engage with members of Congress throughout the lobby day. So this slide largely highlights some of our partners, including the Global Health Corps, as well as the United Nations Foundation, GFAN, the One Campaign, the U.S. Global Leadership Coalition, the Global Health Council, and then also the Kaiser Family Foundation. We really rely on our partners to amplify messaging. When we have the president's budget come out, we all work together, and it's important for partners to work together in messaging and advocacy to really create the change that we're looking to achieve. So target audience. This is largely our target audience, the budget decision makers. We are looking to reach the leaders of the appropriations committees in Congress, Chairman Frelinghuysen and Ranking Chair Lowy in the House, and Chairman Cochran and Ranking Chairman Leahy. We are also looking to leadership and members on the State, Foreign Operations, and Related Programs Subcommittee on the House and Senate Appropriations Committees. We will delve deeper into who they are during next week's in-person training. For those of you not coming, reaching the budget decision makers can be done in more ways than just meetings on the Hill with key players. You can write letters, or you can call your congressman and senator's office to support the international affairs budget, global health programs, and the Global Fund. You can use social media, write op-eds, blog posts, Facebook posts about issues that matter to you. So what are some of our key messages for global health advocacy? First, our key message is to support maintaining foreign assistance in the entirety of the international affairs budget and global health investments. Some of our key messaging we focus on are the following arguments: the moral argument for saving lives, the economic argument, the global health security argument, and the diplomacy argument. The economic argument cannot be understated. Some of our top talking points for the economic argument are that 11 of 15 of our U.S. top trading partners have been recipients of U.S. foreign aid. 95% of U.S. consumers live outside of the U.S. border. Malaria-free countries have 5 times greater economic growth than countries with malaria. Every dollar invested in malaria control yields $40 in economic returns, and every dollar spent on tuberculosis generates $30 through improved health and increased productivity. The global health security argument can also not be understated. We have been reminded repeatedly about outbreaks such as Zika and Ebola that disease knows no borders. Containment, prevention, and evidence-based treatment of epidemics are national security matters that we cannot afford to underestimate or underfund. U.S. investments in disease programs like the Global Fund support strengthened health infrastructure to help prevent future deadly threats like Ebola and Zika from spreading. Finally, the diplomatic argument is that investing in global health is an essential part of U.S. diplomacy. Bipartisan analysis has found that global health investments support American diplomacy by generating goodwill, accelerating development, and reducing social and political instability in countries with a heavy burden of infectious disease. Basically, countries that we are providing healthcare to are more likely to like the U.S., and that has been repeatedly found in studies. In terms of the Global Fund advocacy messaging, the Global Fund is an efficient, effective model of global health financing. It's results-oriented and accountable. The Global Fund represents a new kind of funding approach that is transparent, results-oriented, and builds country ownership for the future. It also supports the success of the U.S. bilateral global health programs. The U.S. and the Global Fund, the U.S. bilateral programs such as PEPFAR, the President's Malaria Initiative, and USAID's TB programs work with the Global Fund to reinforce each other's work across the globe. They work hand in hand to avoid duplication, increase transparency, and financial efficiency, and they also scale up innovative programs. There are also economic and security benefits for America. Maintaining the U.S. commitment to the Global Fund alone could support at least $96.7 billion in economic gains in coming years. Funding for the Global Fund also leverages funds from other donors and implementing countries, meaning the U.S. is not alone in investing in global health. The U.S. galvanizes this additional support by requiring a 2/3 match from other donors worldwide. For every $1 the U.S. invests in the Global Fund, other countries and private sector partners must invest $2 more. In terms of further messaging for the Global Fund, the projected impact of the U.S. portion of the $4.3 billion pledge to the Global Fund from 2017 to 2019 would result in 5.7 million lives saved, 81.7 million HIV, TB, and malaria infections averted, and $94.6 billion in economic gains. And this is just the results of the US alone. So in terms of Global Fund advocacy and key messagings, this is a visual of the impact of proposed cuts to the Global Fund. As you can see, the proposed cuts are $425 million to the Global Fund, and this would result in 8 million fewer lives saved, as well as the other things that are highlighted on this visual. The visual is really effective because it demonstrates the effect of the cuts. In a world of numbers about budgets and billions of dollars, it's important for Congress and people to see the programmatic effect on lives. Finally, advocacy works. The proof of this is in 2018 omnibus by Congress, which rejected the president's 2018 budget for both international affairs and global health. So again, remember, your voice matters and advocacy does work. So let's get out there, let's get excited and make some noise and get ready to advocate next week. Thanks so much.